All right, what are some side effects or possible side effects of improved medical technology?
Like maybe some retarded people, I'm not trying to, but no, not like that, but they don't think right, or they just think technology can fix all our problems. Just maybe because they know that we have better technology, they won't take care of themselves as much.
Will you say that again?
People that want to be retarded.
Yeah, like not that they're retarded, but maybe like they don't.
They want to.
Yeah, like they just act retarded and think that technology can fix all our problems, and because they know we have better medicine, then they might just not take care of themselves as much as they did before.
Why would that be a problem for our society?
Because then everybody would get sick, and then everybody would die.
Like,
Yeah, kind of like that. Well, I'm not saying everybody, but then everybody's not going to take care of themselves, and then maybe the medicine doesn't work, and the germs just keep getting bigger, and then they're stuck with the sickness, and they die.
Okay. What else might be some negative side effects of improved medical technology? Sure.
If medicine improves, then usually germs improve and bacteria does. And sooner or later there'll be a bacteria that we cannot cure.
Some people get addicted to sleep,
What do you mean?
like prescription pills, like they have easy access to it and can go anywhere and order them, and they use them like in the wrong way and they get addicted to them.
These all in the streets.
They could do strawberry.
Okay. Well, and abuse of medicine I think is always a problem. What other, like right now we take medicine to get better from like sicknesses. What other things do people take medicine for?
the overdose themselves.
Well, yeah. What other positive things do people take medicine for?
Oh, that's not
Like depression sometimes.
What?
Depression.
Okay.
vitamins.
What?
Like vitamins.
Oh, okay.
Most of the accidents.
Oh.
Like some weightlifters will like take adrenaline. They do help. Painkillers.
Okay. Now, I'll use there's a couple of different examples that I kind of want to play off in there. But let's take the example of painkillers. Why does your body hurt you?
Because it's growing.
Okay, could be. Why else?
That's because you like you're just doing something else, kind of like sitting down the whole time, and then when you start doing something else, your body's not used to it, then it starts like aching or something.
Okay.
Isn't it as a defense, like when you have a disease or a virus, like you heat up, you start warming up and defending yourself?
Okay.
Like when you get hurt, like tear your ACL, like you get my body through it, so you have to take medicine.
Right, but why does our body give us? What's the point of sensing pain?
Tell us.
Because it.
What?
To tell us.
To tell us what?
That is.
that something wrong is going on with your body.
Okay.
Or can also like our body is warning us that we're doing something that our body does not like.
Okay. And if we, like, let's say we get to the point where we get to the point where we have drugs that make it so we don't feel pain, what could be the problem?
Oh, like when you do get sick, then you won't know if you're sick.
Oh, like if you break a leg.
What?
If you break a leg, you wouldn't even know.
Okay. Now, I'm not saying that that's going to happen because I think some of the pain that we have, like I think about how, oh, I don't know, if I get a headache, I take like ibuprofen or aspirin or something and it goes away. But at the same time, like I may not be paying attention to how often I get headaches because they go away right away. But if I get headaches a lot, that oftentimes means that there's something wrong. And sometimes we don't pay attention to that because we're able to make the pain go away, and that's all we really care about.
Like one time my cousin, she was picking up shards of glass, and like she didn't notice that she cut herself really deep, and like right above her elbow, and like it was bleeding for a long time, like for 30 minutes, and she barely noticed, and she didn't feel anything, but it was like really deep.
Was she on medicine or something?
No.
You don't have a lot of nerves in your elbow, but I don't get into that. Rose, what did you say before when I asked I asked a question and you had a response to it, and I think I wanted to use it.
He said like, what do I mean? And I said
Or
because
depression.
people have like a lot of easy access to ordering pills and getting them without even having to order.
Well, it was depression. Okay. Now, at one time, we didn't like. Some of you may or may not. You don't need to say anything, but some of you or some of your classmates may be on medication because they have a something called attention deficit disorder.
Oh, I did.
And so what the medicine does is it helps them pay attention. Okay? Now, if we keep giving people drugs for things like not being able to pay attention, what messages are we sending ourselves?
Medicine can do anything.
What?
Medicine can do anything. We don't like what their person or like we don't like. I forgot.
We don't have to do anything, or technology can just do it for us.
Huh. Why is that a dangerous message to be sending ourselves?
Because then we don't work hard, we're just like, whatever, why bother and pay for it, not just have medicine and don't make anything.
And if you're on an ADD medication, I'm not saying that I mean, there are some legitimate cases of ADD. I'm not saying that there's something wrong with that, but if we keep just, oh, we got a problem, let's find a drug to solve it. Oh, we got a problem, like depression. Sometimes somebody might be in a bad relationship, and that's why they're depressed. But if we give them a drug to get over the depression, they stay in that relationship, and that's the problem. And so sometimes treating things with like medicine doesn't really get at the cause of the problem.
It's like never finding a solution.
Kind of. And then the one other thing that I want to point out is that as medicine gets better, what happens to how long people live?
Gets longer.
Okay? What would be a problem with people living longer? Or let me ask that again. What would be some problems with people living longer?
Overpopulation.
Okay?
Big word.
More old people.
Okay?
Might be in like pain if they're living that long.
Okay?
Might start to kill each other.
Okay?
Why would they stick to kids?
We keep having to like,
Whoa, hold on.
we keep having to like make more stuff to support their needs.
Okay? And right now in our country, when you hit like 65-ish, you get something called Social Security, which is basically government health insurance. Well, how does the government pay for the health insurance of people who are over 65?
Us.
Okay? Now, if we have people living longer and longer and longer, who's paying for their medicine?
We are.
Government.
The government, which means we are.
Children. Sucks. Children. Like a
So, yeah.
Oh.
And so I'm not saying that we should want people to die. People, stay with me.
We just don't want to live long.
I'm not saying we should want people to die, but at the same time,
We should.
yeah, death is a natural thing, and it's a good thing in a lot of ways because as you get older and older, what happens to your quality of life? Like at some point, life becomes
Boring.
well, not dull and boring, but you might be in pain where it's not worth living. You might not be able to do certain things that you enjoy anymore, so it's not worth living. And at some point, we got to ask ourselves: at what point are you alive but not really living? If that makes sense.
In your sleep.
Well, I'm talking about like at what age? So that's just something to think about.
When you were
How old are you?
I'm 28, not 9 soon. I hope.
Age of 28.
Watch your estimate then.
You'd never know when you get